So, welcome back. We are ready for the panel discussion on the future of medicine and how to get there. It's a very complex issue. Now, the panelists already have given their presentation. So let me start with the Vanguard initiative. Wim, you just talked about it. You showed us the methodology. But yeah, what are the lessons learned from this initiative?
That's a very good question.
Thank you.
I should ask some people in the audience, actually, because they are doing the daily job in the activities. We're so proud that we are developing the activities ourselves, that they should be the ones speaking. So I'm now representing the Vanguard as well, but as said, I'm also co-leading one of these 7 pilots projects. So I also have the right now to speak as one of the practitioners, I would say. The big lesson learned is that it's going way too slow. We have an incredible agenda, and I think we are really unique. And there are people in the room like Mark Pattinson, who was here very active yesterday, who was also very much involved in this process. This way of collaborating between regions and what we are trying to achieve is really unique. I mean, there's a reason why we started with this 7 years ago, and today there are almost 40 of such partnerships. So clearly, this is corresponding to a need. But then it appears to be quite difficult for the regions who are actually initiating this to actually take the next step, which is this access to the regional funding. And as said in Vanguard, literally next week, we're going to contract an expert to do that, but it took us 6 years to get our own founding members to the step like, okay, actually we should put our money where the mouth is. So this is a huge step forward, hopefully a big phase and hopefully a huge step forward. It's a pity on the one hand that it took us so long, but nobody else did it either. So still we are a vanguard in this Vanguard initiative, and a pity that it went a bit slow. I think we have the right to say that. We need to say that to keep ourselves motivated. But if this works, it's going to have an incredible effect, because this is a Vanguard-specific initiative, so only 36 regions. But if we can really show what are the reasons why it didn't work in the past, this is going to have a huge effect, and I think it's going to be really a leverage for many other regions in the whole of Europe.
Let's look at the regions then, Gianni. It's going way too slow. What can we do to speed up? What can be done?
Well, I think first of all, can you hear me? Yeah. It's also a good question. So first of all, to speed up is, as we have heard, is to engage them. We have a good number of regions that are involved in Regions for PERMED, SAPHIRE, and also IC-PERMED, but the number is still low. It's still too low. We have tried to address this with this institutional event that we have done, like the one in March with the European Commission and European Parliament. So to put some like peer pressure on them, and I think this is good, because we have received contacts from other regions that want to be involved. I think so. First of all, is raise the engagement. To raise the engagement, raise the communication. Also, be beyond the regions that have already been involved, and I think people in the IC-PERMED, regional representatives in the IC-PERMED can be kind of ambassadors, and we are witnessing it. Like our German partner from DLR has spoken to like over 10 regions a couple of months ago. I myself, I'm speaking to some Italian regions, so also communication is key, and we have to exploit SAPHIRE, Regions for PERMED, and IC-PERMED to communicate with them, and also to reduce the time to the key person. And we have understood yesterday that this is also one of the problems.
So raise the engagement, raise the communication.
Yes.
Rositza, how do you see the future of personalized medicine? from your point of view?
Well, short answer to this would be, as a health economist, I see it in terms of costs and value. But to expand a little bit on this, funding. To expand a little bit on this, and what we've also written in the position paper, that's about lessons we learned from our project and the perspectives ahead. We now can say that despite that, the expectation with personalized medicine is that it will decrease costs or at least sustain them because of better targeting treatment, because of better selecting patients. We can
more efficiency.
More efficiency, yes. We can say that the cost consequences of actually introducing the personalized medicine interventions in clinical practice are usually larger than we expect, and we have to take this into account. And also in terms of value and clinical benefit of personalized medicine, for example, specific personalized medicines as gene therapies, they have a value over the lifetime of a patient, and we're still unsure of what that value would be. And I think that's very translatable and very important for regions, especially regions that want to implement personalized medicine, because they're the ones that have to provide the infrastructure and to pay for it, but also they're bringing value to the citizens that live in this region. And also they have to make sure it's equitable. Everyone has access to it.
Yeah. So there's still a lot of uncertainty. Einar, you already talked about it. European partnerships are under development. What are the favorable scenarios? What can be the ideal role for the regions?
I would say what they have been doing already now, I think it has shown what is the good role here, because they have been able to show the best practice examples, as we call them.
But we're not on track because it's going too slow, right?
Yes, it's going too slow, and the only way you can speed it up is to really show the world that it works, that it's worthwhile. And I appreciate the comments on the health economics, and we can have a longer discussion on that one, because I really appreciate your results, and they are food for thoughts. But I also think that there are some dimensions which maybe should be included in your conclusions. And one of them is the cost efficiency, because I'm not sure that's the right term to use when we are talking about the health of our citizens. So maybe it's not cheaper to do personalized medicine, but are you getting a better society? Are you getting more healthy society? Are you getting more productive citizens instead of patients in the society? I think it's worth the investment. So there are some aspects there which I think need to be done. But I would like to say also, the examples from the regions should help push the decision makers to solve the bottlenecks we see right now. We heard a lot about bottlenecks around data access and all kinds of things. They need to be solved in order to get the full benefit of all things. And this is kind of where the regions can help push it. And just one more comment, that is, it was mentioned, the way they can do it is to do pilot projects, demonstration projects. And some people are not so fond of it because they say we do this pilot project and it ends and stops and everybody forgets about it. What we need to do in a much better way is to communicate the results so that they can be used in a better way going forward.
To communicate and to implement them.
Yes, exactly.
Yeah, because I think it was in your presentation also. How can we ensure access to personalized health in all the European regions? Because some are doing very well, others not. So the initiatives you were talking about, what?
Well, I think the European Partnership of Personalized Medicine can do a major difference here because, as I said, there are different ways to do personalized medicine, and in some places, a number of regions they do very much kind of the, you might call it, try to do the Rolls-Royce model.
Mm-hmm.
But in other cases where the resources is not so abundant, you need to do it differently. And it's possible to adapt these ways of implementing personalized medicine. It needs to fit. It needs to fit the healthcare and the healthcare system that's in place. And we need to remember that they are very different if we go from region to region and from country to country. And we need to take that into consideration. There's no one size fits all here.
No, that's clear. One size does not fit all. Yeah, you are a good example, Jenny. How to reach then, all regions and especially the decision makers. How do you do this?
Yeah, I mean, there are multiple decision makers within the region. It depends on the action that you want to undertake, the activities that you want to carry out. But usually they are in the same building, so this facilitates. But also the way you communicate with them is different. So when we want to engage the decision maker for investing in research and innovation through ERANET or through the European Commission, European Partnership on Personalized Medicine, you provide the benefits for the research environment. You provide the benefits for producing new knowledge and try to facilitate this into clinical investigation and so on. When you want to implement personalized medicine, sometimes you have to, and this is what we are doing right now, you need to build digital infrastructures, and the decision maker is slightly different. And the model and the way you communicate with them is slightly different. The benefits you highlight are slightly different. So personalized medicine is a broad concept. And so the way you engage the different decision maker, the different key person in a region need to be different. But what is good is that the way SAPHIRE, Regions for PERMED, and all the SAPHIRE and all the projects that have been funded already have produced massive documentation, really good, very scientifically based, evidence-based. So what you need is just to show them, show them the importance, show them
create
the benefits.
More awareness.
Yes, and you create awareness, and the relation with the industry is also fundamental. And sometimes, like what we are doing right now, is we have a table with the regional representative, industry representative, and we are trying to actually implement a sort of shared digital shared data platform so that researchers and innovators can access and produce more knowledge, more innovation with the health-related data that are collected within the region.
Yeah, create more awareness, communicate more, lobbying more. And often a decision is made by the cost, and money is, of course, very important. How can the regional funding be aligned with the other funding initiatives?
Yeah, that's a good question. I would say maybe a lot of the funding coming, there's a lot of funding coming from the European Commission. And I think there could be, and it's often not very clear what kind of funding is available from the Commission. So maybe the Commission could do an effort in order to try to make it more visible for the regions. I mean, what is possible for them to get that kind of funding. Sorry, yeah. And so that is one way. What is maybe more difficult if you go at the national scenes, how can, because there's also, the regions belong to nations also, and there's also national activities going on there. And this is kind of a bit more individual from country to country, I would say. So from an overall perspective, I would say kind of the Commission funding is very important because it's really large scale. And there could be maybe a bit more visibility, what are the possibilities for regions to get
Yeah, focus more on the possibilities. Yeah, so we can provide personalized healthcare for all the regions, so everybody is involved. Are there any questions in the room? Over there, gentlemen.
Balázs Nagy from Heckle Perman. I'm interested in the pace of change you foresee, that personalized medicine is going to be a standard part of health care in different indications with regard to different regions, because I see differences between the regions, like if you compare the Eastern, the Central European, or the Western and other areas of Europe. And also if you just compare the different indications or different areas of diseases in which, where personalized medicine can go forward. So is there a heterogeneity in the pace of change, and what is the pace of change?
Your question is for?
For the
four?
Yeah, or whoever.
Yeah. Yeah, can you answer this?
I'm gonna answer from our perspective, from Vanguard's perspective. We will not modify the pace of change in your industry, but I think we can help in facilitating it and trying to give an answer. If we had just discussing just now about inequality, we can also, as Vanguard Initiative, not give a solution to the inequality of access to the results of personalized medicine. But I think we can contribute to minimizing the inequality of access to, for example, demonstration facilities. We have seen in our network, because I was starting very strongly with saying it's going way too slow, and it really is. People who know me know that that's my big opinion, but we also have some quite nice results. Very often, industry, let's say, doesn't know what's there to offer in terms of research infrastructure. So that's the first start. If we're talking about awareness, it's also that awareness. In the 3D printing area, again, the one I know best, we have done a project where we have been mapping all demonstration facilities for 3D printing industry in Europe. We have found rather easily, I have to say, more than 400 all over Europe. So creating that transparency, we have 400 infrastructures where we have mapped up to the detail level of an individual printer, including all the training facilities and engineering services, what they can offer to industry. So of course, there are limits in proximity. A Finnish company will rarely go to Portugal or to Bulgaria, but it prevents at least that governments are investing in facilities which already exist. This is optimizing public investments, and we facilitate the access to those centers. So it starts by linking them, and then only then starting the discussion on what needs to be upgraded or built as a new infrastructure. So that's part one. And then you can start having the rest of the discussion. But this basic issue is really, really important.
Yeah. Einar, I saw you nodding.
Well, I think that's a very important aspect in terms of seeing how it can be done equally in all regions, and I can also include all nations, so to speak. But I would also say that one aspect is kind of the techniques that is needed in order to do this. But the other thing is also, as I have said before, the level of development of the different health systems. I mean, they are very different if we go through Europe. And you cannot do wonders, and as I said, and say, okay, this is what we'll do everywhere. So you need to look at each region and each country and see, where are you right now? What are the possibilities? And for some regions, there will be possibility to take it from a very advanced level and move it from there. In other cases, you need to go very much back to basics in order to get it done. And the only way you can figure out how to do this is to get a communication going and to get an understanding on, and that goes two ways. So one way is to say that we, in various aspects, might be called experts on PM and how it could be done. So we can give some information and knowledge. But it's also important kind of that the regions, in particular the regions who are not really involved, they start to get an interest and start to learn about what are the opportunities, what are the chances for your place in order to promote this thing, and how beneficial it can be for your citizens. And that interest needs to be generated. And that's why I see, for example, the regional CSAs, the Regions for Permit and SAPHIRE, I mean, they're trying to do a very, very important job in order to raise that awareness in these regions.
So it's about sharing information, working together, and trust, right? Yeah, Gianni?
Yes, and I agree with what has been already said. We don't know how it will, how our healthcare systems, let's say, will look like in 10 years, but we know that they are changing, and they know that there are inputs coming from different stakeholders. So personalized medicine is an approach, and is a goal, and it actually requires a lot of further action from the industrial level, from the policy level, from the regulatory level, from funding level. And this is when the regional ecosystem comes very handful, because many of these, let's call them barriers, can be handled at the local level. So when you have, and of course you also need around the table people with the right background, because, and this is something that maybe makes our foundation, TLS, the right player, because we have, within our organization, we have bioethicists, we have intellectual property managers, we have a wide range of profiles, and every time that there is a request, let's say coming from researchers who want to access the data, the clinical data, we sit around the table and we are trying to understand, formulate better that need, and then trying to find a solution with the people either in the region or in the hospital or in the agencies that are around the regional government. So that's what I think it's very important, like having the right people to engage in the discussion, to frame the needs and help all the stakeholders to co-create a solution.
Yeah, it brings us back to where we started yesterday, finding the right person, right? Right. Okay, we're running out of time. Perhaps one last question, yeah?
Yeah, hello, Timo Streicher, working for IC2ProMed. My question would be maybe to Gianni Derico regarding this global scale of personalized medicine and how well aware the regions are of developments and how well they perform on a global scale. So are they aware of the developments such as Greater Bay Area in China or in the US? And I also know that, of course, your involvement with SAPHIRE, but is your impression that the regions are fit for this global competition, or do they really focus on being best in class on the European level?
It depends on what we mean by region. If by region we mean the researchers who work in the regional hospitals, they are aware. If by regions we mean the industries that have headquarters and labs and facilities in our regions, they are aware. If you talk about regional authority like person, they have other needs. They're dealing with COVID and the aftermath of COVID. So like from the economical point of view is quite a disaster. So we're trying to recover. So and it's okay. Like it's good that some know and some do not know. What is important is that for the researcher who knows what's going on the global level, they can come, they can sit, and they can say, I need this in order to be competitive on a global scale and help you going there. And then this tell us, I mean, gives us the possibility to sit with the regions and the regional authority member, the regional stakeholder, and says, okay, what we can do to actually facilitate this. So all in all, I think that the regions are aware. Yeah, but it depends on the stakeholder. But all together, they need to collaborate, because we don't have access to data if the region doesn't have a legal framework in place, and we don't have access to data if there isn't 10 postdoc working in the regional facility allowing interoperability and so on and so forth. And so that's...
Okay, thank you very much. I'm afraid our time's up. Thank you, panelists, for your participation. And perhaps some final words from Kathleen Dont, who started this tremendous job 3.5 years ago. I must say a big thank you, Kathleen, for all the work you've been done, and of course the other members of the team. Yeah, I think